Dear friends, as we know that about 85% of breast cancers occur in women who have no family history. Therefore, knowing the factors which can be modified which increase the risk of developing breast cancer becomes very important. Why? Because if we know the three components of AAA, that is A, first part is aware, we can go to subsequent A, that is avoid, and then go to the third A, that is assess the risk, and we'll be more inclined to activate the BRAHMS protocol. Okay, so I have already discussed about estrogen, pregnancy, breastfeeding, menopause, nulliparity, obesity, physical activity, alcohol, smoking, use of oral contraceptive pills, and breast implants. I'll now be discussing the other modifiable risk factors which do play a very important role and they increase the risk of developing breast cancer in detail. But still, if there's any aspect in which you need more clarification, please feel free to write in the comment box and I will discuss them subsequently. Okay, now something which is very important, that is night shift work. A recent data analysis of around 61 studies which was conducted throughout Europe, North America, Asia and Australia examined whether people who stayed up all night for work had an increased chance of developing cancer. The study included more than 3.9 million women whose careers required them to work night shifts. You will be shocked to know that the strongest correlation was seen with breast cancer. For every 5 years, a woman worked the night shift, her breast cancer risk increased by 3.3%. Please, I'll repeat it again. The strongest correlation for night shift work was seen with breast cancer. For every 5 years a woman worked the night shift, her breast cancer risk increased by 3.3%. This population was also discovered to have an increased risk of digestive system cancer and skin cancer. Now you will be asking, who are these people, who are these ladies who are working at night? Nurses. Yes, nurses who worked night shifts had a higher incidence of breast cancer and lung cancer. And as per CDC, that is Center for Disease Control and Prevention and National Toxicology Program, NTP, night shifts affect the body in multiple ways. And the most important manner is by circadian rhythm disruption and its relation with melatonin secretion. Now, how does the night shift working affect the human body and how does it predispose to develop cancer? By two main mechanisms, that is by the circadian rhythm disruption and melatonin secretion suppression. Disruption of the circadian rhythm results in nocturnal melatonin suppression, which can act as a carcinogen. Carcinogen means promote cancer development. Since melatonin plays a role in preventing tumor growth through antioxidation, anti-angiogenesis. Anti-angiogenesis means prevents the formation of blood vessels which will provide the glucose and oxygen to the cancer cells. So it prevents that and it has an important function in immunity regulation. Reducing natural melatonin release. Now, when you're doing night work, you are reducing the natural melatonin release, which is an effect of being exposed to artificial light during the night time. So you understood? Because when you're working in the night, we're getting exposed to the artificial light. Now, this artificial light causes suppression of melatonin secretion. Now, melatonin is a protective chemical. You are suppressing it and therefore you're getting predisposed to develop cancer and increase cancer growth. Now, it's also believed that when the circadian rhythm is disturbed it results in changes of the clock gene expression, making them more prone to cancer. Many of you might wonder that what can be done that a night shift worker can do and we still remain healthy. Although we don't know the specific cancer risks potentially associated with night shift worker, but few factors have been found to be causing a higher risk. Specifically, number one, night shift work of at least 3 hours between midnight and 5 a.m. That is, night shift work of at least 3 hours between midnight, that is 12 o'clock, and 5 a.m. Frequent night work. Now, how many times in the night, if you do a night duty, will you have an increased risk of breast cancer? This is very important. It has been found that those who did 3 or more nights per week, 3 or more nights per week, and those between 3 hours between midnight and 5 a.m. increased the risk of developing cancer. Long-term night shift work. Now, long-term night shift work, few studies have shown 5 years, few studies have shown 10 or more years. But if you can avoid it, please avoid, shift it. Now, those who are beginning night shift work in early adulthood, such as before the age of 30. So if you are a nurse and you're doing night shifts before the age of 30, or you are in any other profession which makes you do night shift works, and you are less than 30 years of age, your breast cancer risk is more. Now, other factors that are more common among night shift works that might contribute, these are the ancillary factors which contribute to development of breast cancer, that is workplace and social stressors, lifestyle behaviors such as more smoking, higher than recommended alcohol consumption, poor diet, not getting enough physical activity, being overweight or obese, and decreased exposure to sunlight and lower levels of vitamin D. So please understand night shift work, how it increases your risk of developing breast cancer. What are the highest risk factors? Midnight to 5 a.m., more than 3 nights per week, and long, obviously 3 to 4 years, maybe 5 to 10 years of night shift work, and those who started doing it before 30 years of age. Plus additional factors: smoking, alcohol, physical activity, sunlight. Okay. So now coming to the postmenopausal women. The postmenopausal women are a special entity because they can have all the risk factors which the premenopausal woman had, which may be such as obesity, lack of physical activity, alcohol, smoking, night shift work, and so on. And what increases the risk further is the use of hormonal replacement therapy, which is taken to prevent the symptoms of flushing and other things because of menopause. Now, HRT, hormonal replacement therapy, has been found to play a very important role in development of breast cancer, especially the use of combined estrogen and progesterone. Now, HRT increases the risk of breast cancer, and this has been found in a study known as the Women's Health Initiative Study, which was conducted at 40 clinical centers in USA in 1991 and had enrolled more than 160,000 postmenopausal women aged between 50 to 79 years at the time of study enrollment over a period of 15 years. Now, you'll be amazed. It is one of the largest US prevention studies of its kind in the whole world, with a budget of $625 million. And one of the goals of this study was to assess safety of hormonal replacement therapy, and it showed that combined estrogen and progesterone hormonal replacement therapy was associated with a hazard ratio of 1.24 for breast cancer development as compared to a placebo. Hazard ratio, is a measure of how often a particular event happens in one group compared to how it often happens in the other group over time. And that was 1.24, which is very significant. The effect of hormonal replacement therapy were noted after a relatively short duration of use. An excess of an abnormal mammogram was observed after 1 year of HRT use, and this persisted throughout the study for 15 years and there's an increase in breast cancer incidence after 2 years. The cancers in HRT were larger, tumors were bigger, more had nodal spread and distant spread, that is, they were advanced stage also. So, my dear friends, I have covered most of the issues, and from the above last so many talks that I've had with you, you would have now understood why women, and more specifically working women, have an increased risk of breast cancer. I'll again summarize it for you, especially for the working women of the world. Number one, firstly, by the time a girl completes her school education, she's around 19 to 20 years of age, has become a woman, and now when she enters a professional college and after graduation or post-graduation, earliest she starts her professional career is around 25 years of age. Now she has joined the profession. She's at the junior most level. This is actually the most critical period of her career. So now she has to make a mark. All eyes are on her. She has to perform and deliver to the best of her ability, and for the next 5 years she has to work day and night, competing with others, devote her complete life to build her career, and by the time she struggles and comes out victorious and becomes a woman of substance, she is around 30 to 32 years of age. During this intense period of struggle, she actually has no time for starting a family, because that would mean 9 months of pregnancy and at least 1 year of breastfeeding and managing a newborn child. Her biological clock demands that she must bear children before 30 years of age and breastfeed her baby for at least 1 year in order to protect her from breast cancer. But that is the time when she is struggling to build her career. She cannot afford this luxury of 9 months of pregnancy and 1 year of breastfeeding her baby at home. Therefore, no pregnancy, no breastfeeding are the most important risk factors for our career women. Also, secondly, use of oral contraceptive pills. As I've already discussed, most of the women in the world who are working are using OCPs, and your combined OCP is notorious for causing an increased risk of breast cancer. Thirdly, even if a career woman manages to have a baby for 30 years of age, she's unable to breastfeed her baby for the minimum duration of 6 months, ideally 12 months, as most of the offices neither provide amenities such as a private room nor promote that their employee breastfeed her baby during working hours in the office. Fourth point, alcohol. Even in cold countries, women don't have much of an option. And now even in tropical and temperate countries, serving and consuming alcohol during official get-togethers, during business deals has become a norm. Most of the career women, even if they don't want to drink, have to face situations where, in order to be a part of the team, to be a part of the core group, have to hold a glass of liquor, further compounding the risk of breast cancer. Fifth, night shift work. I just explained to you how night shift work disrupts the circadian rhythm, causes suppression of melatonin secretion, and increase the risk of breast cancer. Last but not the least, stress and strain. Her biological clock, her work, her family requirements, her career requirements. Where will she go? These combined effects of reproductive history, breastfeeding, so many other factors account for substantial fractions of the difference in the breast cancer risk between developed and developing nations. And now this is changing. The developing nations are now going to face the same consequences of the developed countries. Do you realize this poor lady, she achieved professional success but at a very high cost. She not only lost out on her peak physiological reproductive period of her life but also increased her risk of developing breast cancer manyfold. I'll now give you concrete evidence of these effects. Look at these celebrities. Angela Jolie, breast cancer at the age of 37 years. Jessica St. Clair, age at diagnosis of breast cancer, 38 years. Eddie Falco, breast cancer at the age of 40. Samantha Harris, breast cancer at the age of 40. Kylie Minogue, breast cancer at the age of 36. Guilana Rancic, breast cancer at the age of 36. Christiana Applegate, breast cancer at the age of 36. Miranda McKeown, age at diagnosis 19 years. What do you see? Just look at their age at which they developed breast cancer. Most of them developed breast cancer before the age of 40 years. My dear friends, breast cancer was the disease of 65 plus. But what's happening now? With every generation, the risk of developing breast cancer is increasing multifold. What should all women do to decrease the risk of breast cancer? And why the working women of the world must unite? I'll be speaking on this issue when I'll tell you as to how to decrease your breast cancer risk. In the meantime, if you want to save yourself, your daughter, your family from this monster called breast cancer, please follow the 3 A's. Aware, avoid, assess. And please activate the Brahms protocol. Please spread this message to all your contacts. For humanity's sake, let's create awareness before it's too late. I have done my bit. I have made these videos to make you aware about the risk factors, specifically the modifiable risk factors. It is up to you now. Please share these videos with all your contacts so that they also become aware about these risk factors and they understand the concept of the 3 A's and BP. The 3 A's: aware, avoid and assess.